Good morning, colleagues, actually. Good morning, those who are here in person and those who are online. I'm going to present on Goal Area 3, which covers violence against children and abuse, exploitation. Um, my name is Cornelius Williams, as introduced by Megan. I'm the Associate Director for Child Protection. So let's start immediately, actually, and look at the context. The numbers speaks for themselves. With less than 12 years left to achieve the SDG, it's worth noting actually the scale of the challenges across the protection sector. And for us actually, which we're very proud of, actually we have SDG 5, 8, and 16. We didn't miss the SDGs like we missed the MDGs. We see millions of children are not having their rights, and we believe that we are off track to achieve the SDG Agenda 2030 goals. Yet we have seen that we can make progress. So we are not actually pessimistic. We're optimistic that if we have the resources, we feel that we're at the point where we can definitely achieve some of this progress. You can see that by the decrease in the child marriage rates. You can see that actually the FGM rates has also gone down, but we're still off track. Well, one of the things we're worried about are those children who are uncounted, forgotten, or even invisible. The children who are not in our data set, the children who are not on your media, your social media feed, these are the children we're talking about. 1 in 6 children live in a conflict-affected countries. There's a 300% increase since 2010 of the number of cases of killing and maiming of children. This is the verified numbers. Over 13,000 grave violations were documented across 20 countries. Okay, we have been doing this for decades. We didn't feel that in 2018 we would be documenting 13,000 grave violations across 20 countries, with Somalia reporting the highest number of 5,000. 30 million children are still actually being displaced by conflict, and we know the risks they're faced with. We shouldn't also forget children without parental care, no children who are in contact or conflict with the law. These are the children we don't see. They're invisible, and most of them are deprived of their liberty. Then those children who will never be counted for the SDGs because their countries don't have a means of counting them, right? But the good thing is, actually, before we start talking about the result, let me just remind you. We have 3 outputs under Goal Area 3. Preventing and responding to violence against children, accelerating the reduction of harmful practice such as FGM and child marriage. Output 3, improving children's access to justice. With humanitarian, we have mainstream a humanitarian response across these 3 output areas. And in terms of the goal, again, the number speaks for itself, with collaboration with government partners, civil society organization, and other partners. And we have actually, it's one of the things that and strategies we're using, the issue of global partnership. And actually, we have a colleagues here from the Global Partnership to End Violence Against Children. We have the partnership with UNFPA on the 2 major, we usually would say actually, these are the largest joint program in the UN system. We were there before they started talking about UN reform, right? And it's about gender, okay? So it's the FGM and the child marriage. But let's look at the results. For violence against children, you can see 2.3 million boys and girls. And then for child marriage, 5 million girls reach. For mental health and psychosocial in 59 countries. And again, we have a partnership with WHO, Save the Children, IRC, and a lot of other agencies. 3.6 million children reach, and I'll talk about that. GBV, we exceeded our target. 47 countries, 1.3 million children and women reach. And children on the move, we did not reach a target. but we doubled the number, right? We have started to learn how to do root-based protection. That is, it's not defined by countries, it's defined by the routes that the children are using. So for that, actually, we were able to double the numbers, as I said, from 2017, where we have 1.7. How did we achieve some of these numbers? Let me take violence against children as an example. I don't think everybody here remember in early this 2018, we had a solution summit led by the Global Partnership to End Violence Against Children, where we came up with some of the solutions. But we have been building up to that with Inspire, our 7 strategies. What we have seen is that we have to have an integrated mix of interventions across the result chain, right? And with this, there are 2 things we have learned. Investing in that worker that is responding to that child. The frontline worker, we have to invest in the frontline worker. We have to train the frontline worker, and we have to give the frontline worker the tools. And that is Primaro. Primaro is a digital public good. It's a first digital public good that we have produced as a child protection sector, and it's an interagency good. It covers the case management for women who have suffered violence, women and children who have suffered violence, and a conflict situation, and a non-conflict situation, it covers children, right? It is a system that allows the worker to collect the data and manage the case in a confidential manner and with privacy. And it also actually, we're hoping that it would, in time, be able to allow us to do analytics on it. So there are 20 instances of Primaro implementation across 12 countries with 1,100 users and 80 organizations, and they're managing the data of 40,000 children. And if we talk about the humanitarian development nexus, in Indonesia, when they had the earthquake and tsunami this year, they were piloting already Primaro in 5 districts. They quickly used it in the area that was affected by the earthquake and were able to reunify children who were affected. So this was, and remember actually in Indonesia, the response were by national social workers. They were the ones using the tool. So let me skip actually, because I could go on and talk about some of the strategies and the milestones, how we achieve some of these milestones. The last one I'd like to mention is mental health and psychosocial. For mental health and psychosocial, it has been a challenge, right? For quite a while, we have been under criticism that we're only focusing on child-friendly spaces, and people felt that we didn't cover what I would call the ecology around that child, the social ecology. We've shifted to a social ecology model, and we're now covering not only the child, the caregivers, and we involve in the communities, because the communities, we believe, have the solution. So we were able to achieve some really significant target, 4 million children, and we had the target we had intended to achieve was 3 million. And in addition to that, actually, everything on the child protection in emergency, we have to have 80% of the target, right? Because we feel it's an ethical issue, that actually we should not set a low target for children who are facing the gravest abuse and violation. But we have some challenges and shortfalls. These are the challenges and shortfalls, despite the strong results. The first one I'd like to mention is the access to justice. Though we have additional 6 countries who have put in place specialized justice system, that brings it to a total of 24 UNICEF reporting countries. This is well below the milestone that we're supposed to achieve. We're supposed to achieve 117 countries. We know we're totally off target, right? And I'll talk about why we're off target. One of the things we believe that we should do, we're off target because of resources. This is not an area that is being resourced. We're off target because it's politically unpalatable right? And people are shying away from it, okay? And that's member states, not me, just member states, okay, right? But we believe we have an opportunity. With the UN reform, we should go for a sector-wide approach and build into the rule of law. We should ride the wave on the rule of law, and there is some renewed interest in it. And we see global opportunities. Anywhere where there is a global opportunities, we will jump on that global opportunities to make a difference. So the global study on children deprived of liberty, the report will be presented to the General Assembly soon. We're going to make sure that we make use of that opportunity when member states are focused on this issue. We know it's going to be difficult discussions. We know it's not going to be easy, but as you know by now, UNICEF never shies away from a difficult issue for children. Birth registration. This is why some of these children will never be counted. We wouldn't know where they are. As we usually would say, these children would be born, they would die, and there would be no sign, no trace, no administrative record of those children. So for those children who are left behind, actually, we feel that we should strengthen the birth registration system. Again, another global opportunity. In 2018, we were asked to set up a legal identity expert group by the Deputy Secretary General because we wanted to, as a UN, one UN system, to collaborate with the World Bank and to leverage the billions that the World Bank had for identity management system. We believe we're on a wave. The World Bank is interested, member states are interested, and we feel we can make a difference. For child protection, it's about leveraging. We'll never have the billions other sectors have, but we have to ensure that we leverage the money. In terms of the alternative care, this is one area where, again, it's going to be a challenge, but we are addressing alternative care in several countries, and it's about care reform. A total of 27 countries reported that they have a comprehensive policy in place, and there was a guideline that was endorsed by the General Assembly. We anticipate, actually, there is going to be a report on the rights of the child in the third committee. We are going to make use of that opportunity, okay? And we're going to make sure that actually we're able to deliver based on that, to make sure that actually we focus on that. Let me move to the lessons learned, okay? On children on the move, frankly, we know what's the problem on children on the move. Governments are not counting in their system children who are moving through their countries. In addition to that, the children don't want to be counted, right? Because they're using clandestine moves. So we're working on that to try to address it. Now, these are the lessons learned. And then there is one more slide. These are the lessons learned. In terms of the lessons learned, I've said it before, targeted investment in catalyzing collective action. We've seen short in the protection from sexual exploitation and abuse. Again, we are working with the humanitarian system, and in the humanitarian system, we have several other agencies who've made commitments to set up the structures, and the target was 34 countries. In 17 countries, we already have a system going, and it's not only UNICEF who's putting resources into it, WHO is putting resources into it, WFP is putting resources into it to strengthen the system. So we're leveraging the system. We're investing in the frontline workers, as I said before, right? It makes a difference, and we have an evaluation that shows that, and in the data system. We're also working on C4D, communication for development, and we're also working actually on the gender issue. In several countries, we're already working with men engaging alliance in 60 communities across 5 focus states, actually, in Nigeria. And in Guinea-Bissau, we're also supporting Men's Club across 40 communities. We're also supporting parenting, and I've already mentioned the Nexus as well. So in terms of our priorities, we're going to make use of all the high-level events that are going to take place. On the high-level political forum, the assessment of progress against SDG, we're going to work with the Global Partnership to End Violence Against Children when SDG 16 will be assessed, and we're going to focus on 16.2. There's going to be a review of 4.5 and 16 as well during the UN General Assembly. And as we celebrate the 30th anniversary on the Convention on the Rights of the Child, we will ensure that actually we again focus on children without parental care. Targeting the children left behind, we feel there are two issues in terms of targeting. The geographic targets of those that I said are not covered in the services and not counted. And we also feel actually there are programmatic hotspots as well. And these programmatic hotspots are the alternative care, the birth registration and civil registration, unaccompanied children in conflict, and separated children and children on the move. Finally, let me talk about before I finish actually, let me just mention a couple of issues. One is the new frontiers in terms of standard setting. On responsible data for children, everybody knows that data privacy is now an issue. This is a digital world. We have to ensure that we have standards when we collect children's data and how children's data are being used. Most of the work on digital privacy have not covered children. So we're partnering with GovLab in the New York University to work on that. Case management, it's an issue. And we've spoken about the social service workforce, and we should set up system. MHPSS, the mental health and psychosocial. We will be working actually with WHO, we will be working with Save the Children, and we already have some support from the Netherlands government, and the UK government is also interested. On administrative data, we have to strengthen the administrative data. Government wants to own their data and to generate actually reports from their data and to look where they're going. There's unfinished business on end child marriage. We're working on leveraging Spotlight, and we also have the issue of, which has always been an issue of social norms, and we feel that we're nearly there. We're nearly there on social norms in being able to measure it and to show the difference that we're making. That's my last slide. And we now have to talk about the money. First of all, let's say we're grateful to those who've contributed to the thematic funds, which total about 27.9 million in 2018. The flexibility has allowed us to respond. There is one thing that is difficult to fund, a systems response, right? And we believe we have strengthened the ability to be able to measure the difference the system makes. The second issue, we had the shout out for our report this morning. That is months or about 2 years of investment in strengthening a reporting system. No earmarked fund would fund a measurement system. And we are discussing with Save the Children and other partners of the common challenges we have with measuring child protection results, right? So with the thematic funds, we've been able to be flexible. 84% of the thematic funds are from member states. The government of Belgium is a new thematic fund partner, and 57% of all our thematic funds come from the government of Sweden. In terms of funding, the goal area 3, we had expenditure 658 million. It's a 5% decrease in terms of expenditure. Violence against children covers the largest share, followed by reduction of harmful practice, child marriage and FGM. And where we are not seeing much is to strengthen the justice system and civil registration. Most of our humanitarian expenses come under violence against children. With additional funds, what we believe is that actually we can be able to strengthen and expand our work on protection of children from violence, the work on unaccompanied and separated children, justice for children, facilitating alternative care reform, and working on the hotspot. Definitely, I cannot forget emergencies and the humanitarian response, especially the work on GBV, which also covers a PSA. Let me take this opportunity to thank our colleagues and everybody who supported us to realize the first ever solution summit to end violence against children, and that the momentum and spirit of that collaboration continued throughout the year across the various result areas. We're excited and look ahead to working with all our partners. And we extend the deepest appreciation. This includes, but is not limited to, the European Commission, the governments of Germany, the Netherlands, Sweden, the United Kingdom of Great Britain, Northern Ireland, all national committees for UNICEF, particularly the national committees of Finland, Republic of Korea, and Norway. UNICEF would like to extend particular thanks to its partners who provide thematic funding and a champion, notably the government of Sweden, Denmark, Norway, Spain, and Belgium. And my last slide. This is not the lesson we would like our children to learn in school. This is not the lesson we would like our children to learn at home. And we believe we have a champion who's the chair of the board of the Global Partnership, and is also the champion to end for PSA. Thank you very much.
Thank you, Cornelius, for your impassioned presentation, and also to highlight in a very honest way where we are not making progress, where we are off track, and to call for areas where we have, but also need greater collaboration of the UN system. I would invite many of Cornelius's colleagues to join us. Sumara Chowdhury, who is behind much of the investment in data that Cornelius has mentioned. Tasha Gill, who is leading the work on child protection and emergencies, including on PSCA. Kirsten DiMartino, and Stephen Light, excellent, and Joseph Mabirizi, excellent. Do we have any questions from the floor? Yes, please.
Good morning. Excellent presentation. I'm Tony Stewart, the ED from UNICEF Australia. Adrian said you would be good, Cornelius, and you were. Thank you so much. Look, this is an area that a lot of us in NatComs, we often focus on, on humanitarian and the other themes. And child protection is still something, I think, with both the private sector and the government that needs stronger clarity. I thought your outcomes were very good today. And I'm delighted to see that you're talking about some of the sensitive areas. I have two sensitive areas that I think we should discuss more. Firstly, I don't see the words child trafficking often in presentations. You can find that if you search deep enough on our global website. I'm involved with the Australian Centre for Countering Children Exploitation. If you want to get the Australian government's attention, and governments in the area, start talking child trafficking. Unfortunately, I've been in 2 emergencies with UNICEF, and I've seen our emergency response team arrive. They were both interested in supplies, whether that's vaccinations or water. No one came for child protection. And yet it is an unspeakable fact in Asia that when there is a tsunami or an earthquake, the first to arrive are the professional human traffickers. We need to be in that space, and the world needs to know that we're in that space. I'd like your feedback on that. The other area I'd like to talk about is child marriages. It is one of the greatest myths in the world that child marriages only happen in programmatic countries of UNICEF. There are children leaving American airports and Australian airports and British airports this afternoon, probably on a one-way ticket to a child marriage. Again, we should be at the world's first when it comes to preventing child marriage. We should have a reputation with all airports, with all agencies all over the world. It's not an African or a Middle East problem, but unfortunately our language suggests that it is. They're my 2 thoughts.
Excellent. Are there any other questions or issues that we would like to put on the table before I turn to the panel? Okay, we'll give you some more time. Thank you, Tony, for your provocative thoughts. So if we could have someone comment on the issue of child trafficking and how UNICEF's programming responds there, as well as the global issue of child marriage, both in program but also in industrialized countries.
Yes. Thank you very much. I will have a go at the child trafficking question. Thank you very much for your question. Indeed, trafficking of children is a very serious child protection issues. It does not appear directly as such under goal area 3, but it is directly tackled and addressed through our programs on prevention and response to all forms of violence against children. It is also an issue that we address under the broader child labor portfolio as one of the worst forms of exploitation of children as well. And of course, it is part of the broader ongoing global portfolio under the modern slavery agenda, of course. And UNICEF does partner also with the ILO and other organizations under the Alliance 8.7 to address all forms of child labor and especially the worst forms of child labor. So definitely may not appear directly here, but it is very high on our priorities as well as a very serious child rights violation. Thank you.
Thank you, and thanks very much for the question, the advocacy for child protection emergencies. I'm Tasha Gill, and I really appreciate that. A few responses to your query. First of all, in 2018, we added an additional emergency response team member. So we now have 2 child protection emergency response team members so that they can deploy more often to more emergencies, and they've been very busy since they've both been on board. The second thing is that there are now 4 regions of UNICEF regional offices that have dedicated child protection emergencies technical capacity, and they both support the ongoing emergency responses and also deploy in order to provide dedicated support to the country offices. The third thing I would mention is that last year and into the beginning of this year, we conducted a study with the standby partner arrangement in order to identify the skills and capacity of all of those on the roster for child protection emergencies and where we need to work together with the child protection cluster system as well as the Alliance for Child Protection and Humanitarian Action to strengthen those skills so that we can more quickly deploy the standby arrangements from those rosters to provide the technical response that we need on the ground, such as family tracing and reunification, which is often the case for East Asia. Unfortunately, the East Asia and Pacific region is one that does not have dedicated emergency capacity on board, and certainly something that they would appreciate assistance in mobilizing resources for. Thank you.
Excellent. Any other questions or comments from the room? Yes.
Thank you, and thank you, Cornelius, and thank you for a very rich and comprehensive report and also a presentation. I see definite, as Anders from SIDA as well mentioned this morning, a fuller report this year and full of very interesting results and a rich analysis. I wonder if you could tell us a little bit more how you work, because on specifically on gender mainstreaming, because I see in the report that it's of course discussed in relation to early marriage and harmful practices a lot, but a bit less in the other results. That's my first comment and question. And then I also wonder if you could tell us a little bit more how you work within UNICEF with the other goal areas on child protection. Because having said that, as we have touched upon earlier, that we got the reports quite late, I haven't been able to actually look through with my child protection eyes on all the other reports. So for the next reporting period, I would love to be able to do so. And of course, I know that it's still possible to do so. I can send in my comments, but if you could touch upon that, I would be very happy. Thank you.
Excellent. Any other questions or comments from the floor? Okay, so we have one on gender mainstreaming, and then also in terms of how child protection is integrated into the work of the other goal areas. I think we just heard the presentation on education, the key focus on violence in schools and in communities.
I'll let
Hello. I'll take the second question about how it's mainstreamed with other areas. Goal area 1, Cornelius mentioned the work on mental health and psychosocial support. So that's definitely an area where we're working with the health sector, WHO, and other health partners in particular in terms of mainstreaming also child protection interventions. We're also working with them on the violence against children response. You saw that in our results, that we're starting to see much more progress now in terms of health systems actually responding to violence against children. And that's something that came up clearly in the administrative data review we did, that sometimes health workers don't actually want to ask children if they see signs of violence and abuse because they don't know what to do with the children afterwards, which I think is one of the most heartbreaking things I ever read. And so that's one of the areas where we're working with the health sector to make sure health workers can have that response that they need to have. And the last one I would want to mention is also the medicalization of female genital mutilation. That's an area we started exploring recently because that's another disturbing trend we see. Goal area 2, and Megan reminded us as well, we heard Danny talking about end violence in schools. And of course, also then there's a relation to ending early child marriage as well, like making sure we can keep girls in schools. Goal area 4, we work with the WASH sector on gender-based violence and emergencies, making sure that that's mainstreamed. We heard the earlier question about emergencies, but that's one area where we have seen progress in mainstreaming. And lastly, in terms of goal area 5 and social inclusion, I think the relationship between social protection systems and child protection systems is very strong, and where it isn't, we need to make it stronger, and that's something we do very much in the field. And also social budgeting. So looking at the analysis around budgeting to make sure that children's issues are reflected, and child protection in particular, which is sometimes a challenge because it doesn't correspond to a single sector the way education might and health does. But that's another area where we're working with our colleagues in social inclusion. I think on the gender mainstream.
Yes, and if I could just add one more, actually, that brings us all together, that's the parenting across the life cycle with our adolescent colleagues, ECD colleagues, education colleagues. No one person, no one sector can address parenting, right? It has to come together. And then in terms of the frontline workers, on social protection, cash transfer, who deals with these vulnerable families in conflict and non-conflict setting. And when they raise the issue of the trafficking, and Tasha spoke, my colleague spoke about the deployment, is that we are internally advocating that UNICEF becomes a champion and the last resort for that worker who holds the hands of that child, right, in a difficult situation. We shouldn't forget the human resources. And these things are not only about supplies. In terms of gender mainstreaming, you know, the GAP has a focus area which we have reported on the the child marriage and the gender-based violence and emergency, which we do jointly with our colleagues, actually. In fact, it's called a co-lead, right, with our colleagues actually in the gender unit. In addition to that, we also actually are trying to make sure that we mainstream the gender into our work, especially on violence against children, doing the analysis that needs to be done. However, it's a journey. It's not easy, it's challenging. We are in discussion with our colleagues in several papers that we have done, okay, but we feel that we're still not there yet. But in terms of the data, we started to see some traction. We started to see some traction even on data on children on the move, other different data and statistics. But we still, child soldiers, actually an interesting point on child soldier was the work that our colleagues did in Somalia, South Sudan, right? Where when the demobilization or the release, not demobilization, started, we were not seeing, in fact, actually, can I give Tasha so she talks about it?
Thanks, Corin. Just a quick point to say that indeed, with the focus on girls and how invisible they have been when they're associated with armed forces and armed groups, when there's a dedicated attention to being able to support the frontline workers to identify girls, we saw an increase in the number of girls who came forward for those types of reintegration programs to 28% in South Sudan. And this is a very significant learning and best practices emerging that we hope then to replicate in all of the other countries, 16 countries currently where we are supporting the identification and release and reintegration of children who've been associated with armed forces and armed groups. Thanks, Gwen.
Could I?
Thank you very much. My name is Joseph. I work with the child marriage team. Responding to the question on child marriages and trafficking, in terms of data and evidence, what we are doing as a group program is to ensure that we're supporting, in terms of what we are doing is to ensure that we are supporting countries to generate data and evidence, looking at the causes and drivers of child marriages. For instance, in the politics, or and I'll point out the Serbian region where we've seen child trafficking linked to marriage. We've commissioned and supported studies there, and this kind of evidence has led to engaging of our offices engaging with governments to support the strengthening of legislations and laws, development and refining of these legislations, but also we are focusing on supporting strengthening of systems, which may include the immigration systems in these countries as part of the child protection within the child marriage program.
Excellent. Just we also, in terms of the child marriage, we have a global partner that we work with, Girls Not Bride, that also ensure that their advocacy covers industrial countries, and they have been in the forefront, especially in the United States, in advocating that all states should ratify and should get the minimum age to 18, right? And they have also been looking at other countries. Then in addition to that, in the receiving countries where these girls are going into, especially Somalia and some of these countries, we are working with the governments in this country.
Excellent. Thank you all for a fantastic report and a wonderful panel session. We have aimed to make these reports more data-driven and have wanted to have the frank discussion about where we're on track and where we're not, as a way to kind of collectively mobilize both the advocacy strength of member states. There are many issues on which you are perhaps as well placed, if not better, to have discussions with member state governments, particularly around some of the very sensitive issues around juvenile justice. So we hope that this provides you with some of the data to be able to engage in that advocacy, as well as those areas where we're seeing, without a step up in financing, we are likely to fall short in terms of those goals. So thank you to the child protection team. We would very much invite you for lunch, which will be served over here. And we look forward to seeing most of you back. I know getting people back from lunch is difficult, but we hope that we can get you back to the discussion on goal area 4, which is every child lives in a safe and clean environment. And we will start that at 12:14 right here. Thank you.